So glad you could spend some time with us on this last day of September. Let's get to COVID numbers. They're down in Chicago. People are getting their booster shots. And what do we know about the side effects of those boosters, though? Joining us to answer those questions and much more, Dr. Shikha Jain with UI Health. Good morning to you.
Morning, Terrence. How you doing?
Fantastic, fantastic, and even more fantastic with this good news. Where are we when it comes to death rates, hospitalizations, positivity rates in Chicago and the state? It's looking good right now, right?
Our numbers are definitely coming down. We're seeing percent positivity rates down around 3%, which is the lowest it's been in several months. We're seeing hospitalizations go down for COVID cases. So we are definitely seeing things move in the right direction. So it's definitely cause for some celebration, although I want to say cautious celebration, because it does not mean that we need to stop doing what we're doing right now, which is wearing masks indoors and continuing to get people vaccinated.
Okay, so with that said, are you concerned or worried we could see an upward spike anytime soon?
I am, because as you mentioned before I came on, we are entering into cold and flu season where the weather gets a little bit colder, and our hospitals in general run around capacity at that time because we have so many people getting admitted with other respiratory illnesses. So the concern is if our COVID numbers do not drop even further, we're going to end up at a point where we're again canceling elective cases or not being able to provide care to all of our patients when they come in with non-COVID related illnesses. So our numbers right now are better. They're around 2,900 average new COVID cases a day, looking at a 7-day average. But remember, back a couple months ago, we were down in the low 100s. So we need to make sure that we still have those masks on indoors. Because cold and flu season is coming up, get your flu shot. And if you're eligible for a booster, get your booster of the COVID vaccine, because we need to make sure that we're entering into this cold and flu season prepared as a state.
Well, you brought it up. Let's talk about the boosters. Pfizer's boosters are available now for a select group. Regulators have not made recommendations for Moderna or J&J's vaccine quite yet. If you want a booster but don't originally get the Pfizer vaccines, can you mix the vaccines and maybe get the Pfizer booster now?
So right now, it's not recommended to mix the vaccines and get the Pfizer booster if you got Moderna or Johnson & Johnson. Dr. Fauci mentioned the other day that there should be some data coming out very soon, talking a little bit more about boosters and about this mix and match kind of plan. So I'm hoping we'll get some information on that in the next few weeks. And when that information comes out, then we should follow those guidelines. The challenge is we need to wait a little bit longer just to find out what is going to be safe, and not only what's safe, but what's going to be effective, and make sure we're protecting everybody when they do eventually get their booster.
Hearing this question a lot too, should people be concerned the boosters will result in different side effects than, say, the first or second dose of the shot?
You know, it's so funny. I was just texting with some of my colleagues about it because I'm actually planning on getting my booster next week because I'm eligible as a healthcare worker. And some of my colleagues have had really significant side effects and some have had barely any. So I think it's really just as it was with the first shot. You might get side effects, you may not.
Well, you keep us updated how you feel after you get your booster shot, please. I want to talk to you about a new poll, too. It came out yesterday. It found vaccinated Americans are actually more concerned about the virus than the unvaccinated. The big question, big concern a lot of people have still is what's the likelihood or percentage a vaccinated person will get what's called a breakthrough infection?
So I'm not surprised that our vaccinated communities are more concerned than our unvaccinated communities. We're actually hearing that even when we talk about getting the vaccine. People who want to get the vaccine are those who are a little bit more concerned about COVID than those who are not vaccinated yet. When we talk about breakthroughs, as we know, no vaccine is 100% effective at preventing the spread of a disease. So I'm not surprised we're seeing breakthroughs. We're still getting more data as to how many people get a breakthrough infection. But the point that I think is really important, if you are vaccinated and you do get a breakthrough infection, the chance of you getting a severe illness or getting admitted to the hospital or dying is almost none compared to those people who are not vaccinated. The people who we're seeing who are getting very sick in the hospitals, getting admitted and dying from COVID are the people who are not vaccinated. So even if you do get a breakthrough infection after you're vaccinated, it's hopefully not something to fear because the chance of you getting very sick is very, very low if you are vaccinated.
And the hope is that the symptoms won't be as bad for you if you do happen to get one of those breakthrough infections. Dr. Shikha Jain, it was a pleasure talking with you this morning.
Thanks so much for having me, Terrence.
All right, that's what I said. My mom loves you too because you make everything make sense. Appreciate your time.
Thanks. Tell your mom I said hi.
I will do. Will do.